1 in 3 Americans have their healthcare data sold without their knowledge. Can you talk about this a little, and then maybe, sort of like lead that into what health exchange is and why you're here? What's the issue here that health exchange is trying to solve?
Yeah, so you're actually kind of right. It's worse than it sounds. So it's 100 million Americans are part of a data set that's curated by one company. So the largest company in the United States for healthcare is United Healthcare Group. They own this provider sort of services side called Optum. What Optum does, they essentially just buy out independent practices, and now they're huge. They're all over the country. And they're all these like small to mid to some of them are a little bit bigger, but usually like small to mid-sized practices across the country. And so 100 million Americans use one of these practices. And when they go in, they sign a form, and that form is like a HIPAA release form. It lets the doctor look at their information, request their information. But they also have a clause in there where they can use your data for research. And the way they do that is they like strip out your name. It's not like identifiable back to you, but it's data collected on you. And those call that, person X or token, 543, whatever it is, right? And they have this huge data set. You can actually look it up. All you have to look up is Optum EHR data set. And they claim to have 100 million Americans. And they actively sell that data to pharmaceutical companies. And the reason that's useful for pharma companies is it can be useful for things like figuring out how much of a population has a certain disease to go after that, like some market research type activity. It's also potentially useful for creating novel diagnostics. So just based on someone's data, can you predict whether they're going to have a heart attack or whether they're going to develop cancer, right? So you can build these like AI engines that are very valuable in the market as well. And then finally, it's actually really useful for detecting new biomarkers and new drug targets. And so the way that's done, say you have 100 healthy people and 100 people with that suffer from a heart attack, you analyze everything, all the differences about those two pools or those two populations. And you can figure out, hey, people with heart attacks had mutations in genes X, Y, and Z. They usually had a higher like protein X level or something like that, right? You can figure out what's going on in a disease population versus a healthy population. And then you can target your drug development specifically around that using that information. And maybe this is a good time to pause, but the reason why it's so valuable is because currently, like that's not how medicines are made. Medicines are, you come up with 2,000 or 20,000 targets in a machine, right? You test it, you do simulations, you come up with a couple hundred. You have your chemist synthesize it. You try it in mice. You try it in rats, and eventually, if it's safe enough, you try it in humans. And people talk about pharma trials, clinical trials, phase 1, 2, 3. I think the rate of a drug going all the way from phase 1 to actually hitting the market is less than 7%, right? So people like this is very random. Like the way medicines are created, like it's not the way you would think. It's more just like we're just trying stuff until it works. But I guess going back to the main point. Because of that, data is very, very valuable. And companies know. And that 100 million Americans that have their data sold, that's just one company. The reality is it's probably closer to like 60-70% of Americans have had their data used at one point by one of these like data aggregation companies. And this is health data, it's protected data. But I just don't think people know about it or realize it. But it happens all the time.
Unchecked governments have eradicated privacy and truth. Those who resist are brought down swiftly, but we refuse to submit. Unipunks are freedom fighters, protected by encrypted shadows. The future we're building is sovereign and uncensorable. The moonlit night is coming.